And we're back. We are wearing the same thing because we are doing these all on the same day, and there's absolutely nothing wrong with that. So next up is body dysmorphic disorder. So this is categorized as an obsessive compulsive or related disorder. The diagnostic criteria from the DSM-5 are just a preoccupation with one or more perceived defects or flaws in physical appearance that are not observable or appear slight to others. At some point during the course of the disorder, the individual has performed repetitive behaviors in response to the appearance concerns. So, for example, if someone is really sad, I don't want to say really sad, that's not the term to use, but if somebody, is upset with their eyelashes, so they have a repetitive behavior they do every day to try to fix it beyond just a normal reaction. C, the preoccupation causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. Again, there's a difference between regularly just being upset with yourself and being upset with your perceived flaws to the point that you can't work or you can't function. And D, the appearance occupation is not better explained by concerns with body fat or weight in an individual whose symptoms meet diagnostic criteria for an eating disorder. Some symptoms range from, needing constant reassurance related to the perceived flaw to going out and getting cosmetic surgery. So we're going to bust some myths with body dysmorphic disorder.
The first myth is that it's just an eating disorder.
False. So someone with an eating disorder has more of an issue with food and food intake and weight. Somebody with body dysmorphic disorder can be focused on perceived flaws unrelated to weight. It could be the way their nose looks, the way their hair color is, the way their eyebrows look, their eye color, their, the way their heart beats. It could be anything having to do with their body. Again, it is classified as an obsessive compulsive related disorder, whereas an eating disorder is not in that same classification. Whoop. Oh, ripping papers.
Another myth is that people with body dysmorphic disorder are just vain.
So vanity is kind of an extreme admiration of your own self, whereas body dysmorphic disorder is an extreme dislike of perceived flaws. I'm going to keep saying perceived flaws because, again, sometimes those flaws aren't there or they're not visible to somebody, and they're completely in somebody's head, which is okay. That is why it's called body dysmorphic disorder. It's kind of like the antithesis for vanity, and I know there used to be this show on MTV where it took people with actual disorders. I don't know why it was on MTV. And there was a girl who had body dysmorphic disorder. That was like way back in the day, and when I first was getting interested in psychology and everything to do with it. And that was pretty much the running joke, was like, oh my God, she just cares about the way she looks. And it's like, no, she can't function and she's petrified. Whether she had it or was for TV, I don't know. But there's so much more to it than just being like, I like the way I look or I don't like the way I look.
So the third one is body dysmorphic disorder isn't a serious disorder.
So every disorder that we're going to cover is serious and can be serious. There was a study of 200 people that were diagnosed with body dysmorphic disorder. Out of those 200 people, 78% of them had suicidal ideations, and then 27.5% of them actually attempted suicide.
So number 4, plastic surgery can cure body dysmorphic disorder.
That is very common with any kind of body disorder or self-disorder. It's a perceived negative self-evaluation. So the flaw is always going to exist until it's properly treated through either medication or therapy. So you can get cosmetic surgery. That doesn't mean that it's fixing the problem, and it doesn't mean the problem goes away. There's either going to be a different problem, or someone with body dysmorphic disorder is just going to be like, well, that didn't fix it. The best treatment for body dysmorphic disorder is cognitive behavioral therapy and behavioral therapy to correct false beliefs and minimize compulsive behaviors. So cognitive behavioral therapy is something that I'm super passionate about, something that I'm actually currently working on right now with a group of people, where we just take the negative beliefs we have about ourselves and essentially break them down and challenge them until they can no longer exist because they don't make sense. No medication is currently FDA approved to treat body dysmorphic disorder, but antidepressants like SSRIs, which are selective serotonin reuptake inhibitors, other antipsychotics like olanzapine have shown to be effective with therapy. Family and friend support is also super important. So remember that body dysmorphic disorder is a recognized American Psychiatric Association disorder. Take it seriously. Seek proper treatment if you are someone who is suffering with it, or you know someone who is, and don't just say, like, if she had an issue with her nose, you know what I mean, and she was legitimately concerned about it and, like, coming at me, like, in tears every day, can't leave the house because she's so worried about it, I wouldn't be like, it's fine. I would love to have your nose. It would mean that she needs some help. So if you know someone like that, talk to them, kind of find out what the root problem is, and recommend them to get some help. This video is much shorter than the other one, so I am going to say at the very end of it that these videos are not meant to diagnose or treat any disorder. They're for entertainment purposes only. I am super excited. I'm so sorry we're going to be wearing the same thing, but if we don't film these all on the same day, they're never going to get done. So I will see you guys with the next one. And the next one is going to ruffle up some feathers. That's for sure. So, see you tomorrow.